Hi everyone, this is Jason, the founder of diagnose, and in this video I want to talk about COVID treatments or possible COVID treatments. But before I get started, I just want to be clear that I'm not a doctor, I'm not a medical professional. This is purely educational based, and if you want it, if anything is going on, to please seek a medical professional and please seek a doctor. All this is information, and it's not to take, I am not giving any medical advice in this video. So these are basically based on my own experiences and opinions, just to let you know. So just to be clear, make sure you get your own, this is not medical advice. This is just a video based on education and information and everything. So COVID has been at the forefront of everything, every day, every moment, pretty much in the world since March. I mean, it was apparent last year, but now it's kind of taken over everybody's lives. And will it last forever? No, nothing lasts forever. But in the moment, it's kind of at the forefront, and you have different sides to it, and so on and so forth. And that's including treatments. So right now, there's different treatment realms that are going about. There's Plaquenil, which is the generic form of Plaquenil is hydroxychloroquine, and it's been used as a babesia drug for a lot of Lyme disease patients, as well as been an anti-malarial drug for a long time, very inexpensive drug. That's been used in combination with like zinc and other methods to try to not necessarily cure it, because you really, totally getting rid of a virus is not a very common thing. It's a very rare thing, but it's used to actually in other countries, to help decrease the fatality rate and increase the life expectancy and the seriousness of it, or at least the data or in other places has shown that. And then you have, a lot of research going into vaccines as well. And on top of that, there's some antiviral drugs are being used, and other peptides and other methods and stuff like that. So I come back to Plaquenil, to hydroxychloroquine. So one of the reasons why it works, or it worked in the Lyme disease world, because it helped work against babesia. And ironically, babesia has a lot of very similar symptoms to COVID. So they kind of are, shortness of breath, fatigue, muscle ache, you develop this lethargy, this kind of like weakening and things like that. There's a lot of very similar symptoms because of the way it affects the blood or the breathing and the blood vessels and stuff like that. And, this whole idea of a cytokine storm and how that affects you, that's very common in the Lyme world. Cytokines are a very common indicator in the Lyme disease world. So specifically, if somebody has, babesia or all these Lyme symptoms, you always look at their cytokine levels. So they're kind of go hand in hand. So coming back to this theory that maybe COVID is very similar to babesia and the way it interacts in the body, then, I would, in my opinion, this is possible things to look at in COVID treatments. You would look at other babesia treatments. And other babesia treatments that have been common, the two big ones that are extremely strong and a lot stronger than Plaquenil are Mepron and Malarone, especially Mepron. Mepron and Malarone have been around a long time as well. So I just wonder, if these are two things that can be looked at as far as COVID treatments. The other things from a more natural side that have been used again for oxygenation, babesia, certain things are things like artisanate, which is an herb that's been around for a long time as well, coming from artemisinin, and a lot of places have used it in combination with vitamin C to try to help resolve cancer and then boost your immune system, and it's very antiviral. The other thing to look at is ozone. Ozone treatment has been really good as well for babesia, oxygenating the body and so on and so forth. So again, if you're going to look at Plaquenil or hydroxychloroquine, or if you even look at the symptoms of COVID, why are we not looking at these medicines? Why are we not looking at all of these things to try to combat it? And we're in a very funny country as far as our medical system goes, where we take so long supposedly to go through these FDA trials, but then the the competency, like you just have to have a 25% or 30% success rate with a lot of these drugs. So, and a lot of times these drugs don't really work that well for all kinds of diseases and stuff like that. So, right now we're in this experimental phase trying to push vaccines, trying to push drugs just to kind of solve this answer. So why are we not looking at every realm and trying to put two and two together and try to do everything it takes? You ask yourself that but a lot of times we know the answer because our medical system isn't necessarily always based on helping people. It's more based on financial gains or politics or so on and so forth. So those are my thoughts. Those are my theories. And again, I'm not giving medical advice whatsoever. That's just information. It's just a lot of it's from my own experience dealing with Lyme and dealing with things. So something to keep in mind. Maybe you can talk to your doctor about it, or researcher. If you're a researcher, if you're a scientist or an epidemiologist, maybe you can look into it. I don't know. But there are answers out there. I'm just saying, there's always an answer, and this is just another opinion, and hopefully you can get some education on it. And keep in mind, the biggest thing, the most important thing is boosting your immune system and boosting your own health in every way, and that's good for any disease and anything possible, So check out diagnose.com and find out more information on how you can prevent disease before it happens.